Helier Hospital, Car Shelton in Surrey. The accent does sound British though, okay? And at an early age, my parents from the land of Jamaica sent me back to Jamaica as a little boy while they remained here in England. So you can tell this is not sunny Jamaica. I'm in a cardigan, a sweater, or a jumper. We know wear those things in Jamaica, trust me, okay? So, I start with a health disclaimer. It's very important. I'm not a doctor. I'm not a diabetic nurse. I'm not a nutritionist. I'm not a dietitian. I'm not a healthcare professional. I'm sharing with you my lived experience, my reality as a diabetic, type 2 diabetes patient. So I'm a patient expert. There's a big difference here. So don't ask me about your leg or your arthritis, your lupus, your this, your that. I won't be able to tell you. I'll tell you straight away, go back and see your GP. Right. But I've had this medical condition, diabetes, for 19 years. Christmas coming 20 years. And I've never taken medication. That deserves a round of applause. And I will take you through a journey as to why it is that I have stayed away from medication by the things that I do. You hear me so far calling it a medical condition. Some of you in your training, or you see this on the internet, might hear it referred to as a non-communicable disease, NCD, or an acute disease, or autoimmune disease. Any of those heard? Autoimmune disease, non-communicable disease, chronic disease, etc. But when I was trained by Diabetes UK, June 12 years, I was told to always refer to it as a medical condition. So if you hear me saying medical condition, simply it's the same thing I'm saying that if you know it as a disease. But I don't like the term disease. Tony Kelly doesn't have a disease. I have a medical condition. That's my take on it. So, I was sent to Jamaica, and as a child growing up in a little district called Whitehall in St. Thomas in Jamaica, I saw the first signs of this medical condition, diabetes. They didn't even call it diabetes then. I had relatives of mine, starting from the top, who had strokes, relatives of mine who were blind, relatives of mine who had heart attacks, relatives of mine who had kidney or renal failure. It meant they had to go into Kingston, the capital, to go onto the dialysis machine. Relatives of mine who had lower limb amputations, chopping off of toes and feet. And some of my relatives died prematurely or early in their 50s and 60s. In the Caribbean, let's say how many Caribbean people are here, we would say, gone to? Oh, right, and some Caribbean people here. So I was at an event yesterday and the person said, gone too far, so you come from Jamaica. Not gone too quickly. And I would ask my relative, what is the matter with them as a little 8, 9, 10-year-old boy? All they would tell me is they have a touch of sugar. Granny has sugar, Uncle so-and-so has sugar. So they minimize or trivialize or downplay this very, very serious medical condition by referring to it as a touch of sugar. I need you to understand, ladies and gentlemen, diabetes is more than a touch of sugar. Fast forward, I went to Micro Teachers Training College, so I taught in the high schools in Kingston. And fast forward, 1979, I returned to the land of my birth, and I've lived in Harborne with my wife, daughter, and son-in-law ever since in Harborne, Birmingham. Okay? But Mrs. Thatcher said, I can't teach here. That was the government at the time. I said, what? This was 1979. I said, why? We don't recognize your qualifications from Jamaica. I'll be honest with you. I think the standard of education in the Caribbean is far better to what I see here in Britain. My wife decided to go on with a 4-year teacher training college degree all over again. I went into another area. I went into the probation service and became a probation officer and a senior probation officer. So I went another avenue. I went for 14 years without a day off sick, 14 years. And then suddenly, my wife noticed the 4 key symptoms that I might have diabetes. T for tired, T for toilet, T for thirsty, and T for thinner. Tired, toilet, thirsty, thinner. I was getting up 19 years ago 4 or 5 times during the night to go to the toilet. She kept saying something's wrong with you, something's wrong with you. But this is typical of not all men, most men. Most men are in denial, like the ostrich, the largest bird on the planet, burying its head in the sand at the first sign of danger. Most men are like that. Women at the first sign of a twitch, an ache, or a pain, they go see the GP. Men gone to the rumba, they gone play domino, they gone play cricket, they gone do every other thing except going to sort out their health issues. Yeah. And if you have men in your life, whether uncles, aunts, grandsons, or so on, you need to take them grabbing, kicking, and screaming to go get their health checks done. And I keep it very simple. Very, very simple. Don't allow men to just sit back. And they know something's wrong with them. Even when they did them going to the church, they say nothing wrong with them still. We need to move away from that, us men. So please, I beg you, health checks. Go and get your men to get your health checks. So my boss said to me, Tony, you've been with your diabetes, you haven't told anybody about it, but I know in supervision. You've gone for 14 years without a day off sick in the probation service. I want you to go to Wolverhampton, which at the time was the diabetes capital of Britain, and go and speak to them about how you manage and control it. I said, okay, I'll do that. So I went. Diabetes UK, the well-known organization, were there. By this time, when my wife kept saying something's wrong with you, something's wrong with you, I went with an early morning sample of urine before breakfast to my GP surgery. She put the dipstick in, she held it up to the light, and she said, you have blood glucose or blood sugar, same thing, in your urine, and there should be none. But I'm going to send off a sample of your blood from your arm that will determine. So that came back 19 years ago, confirming. You heard me say at the very beginning, in my case, it was hereditary. It runs in my family. It's in the DNA, the genes, the metabolism. So I decided, do I continue to eat 6 and 8 tablespoons of rice and peas, which I love, or do I make the behavioral or lifestyle changes to keep the complications that I alluded to at bay? That's what I've done for the last 19 years. So my boss sent me to Wolverhampton. I spoke there for 10 minutes from the heart about what I do. Diabetes UK said, come over to Macedonia and help us. You got to get to the gap, you can chat, and when you articulate, you'll be able to reach out to people. So that's what I've been doing since early retirement, going all over the place. And when I say all over the place, I'm talking all over the world. Countries invite me, they see me on internet and webinars and so on, and they say, you gotta come here, because you're not speaking with a hot potato in your mouth, you're keeping it very real, you're keeping it simple. People, communities will understand you. So, Diabetes UK, I got pinched by the NHS, so I'm with the NHS now as a volunteer. I start off with the NHS here. The Second World War legal history was 1939 to 1945. And when the World War finished in 1945, there was a slogan with a man on it saying, your country needs you. They went to Africa, they went to Asia, they went to the Caribbean to recruit people as bus conductors, as bus drivers, as factory workers, as street people to clean the street, etc. So in 1952, my aunt from Bath, St. Thomas, Jamaica, came here to go to study as a state registered nurse in Tooting Bec. My mother on the left, the only black person, this came in 1953 to train as a state registered nurse. My aunt, that's your sister, came in 1956. So 3 sisters from one family came here to train as nurses. Now some people say, Tony, why you have to big up your family? It is about changing the narrative. When I go to these events and say other white people being part of the NHS, I take great exception to that. Black people, African, Caribbean, and Asian people played their part. Am I right or wrong? Come on. So that's why I put them in there. I have no qualms in putting them in there. Young people need to know that they were part of the system. So they came here. I call them the 3 degrees. Remember that book? Yeah. Right. 3 black women came here. I move on quickly to talk about cooking. Growing up in Jamaica, every time I made a beeline for the kitchen, my grandmother, my grandaunt, and my granduncle would say to me, in pure Jamaican language, go take your book, meaning go and take your book or go and do your studies. In those days, in the 60s and 70s, it was not the done thing for boys to be in the kitchen. It was the domain of women. And it's can't cook, won't cook. So I've grown up, I couldn't even boil an egg. And when we got to school in Jamaica, and over here as well, the boys were shunted into woodwork and auto mechanics, and the girls do sewing and baking and dressmaking. We've got to stop that divide. We must make boys and girls do both things. So when they've flown the nest and left home, they're able to sew the button on their clothes, and they're able to cook, and they're able to iron, and so on. So I used to stay at home when I come home from work. My wife was a teacher. She or my daughter would come home and be sitting down larding. They would have to put the pot on fire at our home back in Harwood. And my daughter in 2008 gave me the best Christmas present I've ever had. 15 Caribbean cookery classes over in Boldmore, Sutton Coldfield. That is me in my pinafore, my apron, learning to cook Caribbean food. So ask yourself and answer it. Who do you think is the best cook now in the Kelly household? And to add to that, when you see the chef programs on TV, what gender are most of the chefs? Men. Men. So this issue of boys not learning to cook and can't cook, won't cook, I can cook, and I'm saying to others out there, learn to cook. The importance of it can't be underestimated. I'm coming on to diabetes, but hard to reach communities. You will see, look it up on the internet, about 24 pages of hard to reach communities. So I go to a lot of these events all over the place, and I say to them, excuse me, to the consultant standing up there, or the professor or so on, giving their big lecture. Who are these hard to reach communities? They're bright, and they're bold, and they're brazen, like Stadium Ball. The Africans, the Caribbeans, the South Asians, the white working class. I said, please never ever call me a hard to reach person. Are they on Mars, Jupiter, in the rainforest, in the jungle, in the Himalayas, in the deep blue sea? We all make up the community. And instead of saying, as a matter of fact, you, the CEO and the professor, and you're the ones hard to reach, because you sit in your ivory tower and you sit behind your laptop and you don't go there and engage with communities. I engage with 150 communities per year. That's my card. I have cards, but that's my telephone number, second line we have at home. That's my email address. Everywhere I go, and I got some more today. I have these t-shirts emblazoned with everything on there, and I have hoodies to match. And people stop me on the train or 30,000 feet in the, excuse me, you work for the NHS Derby? Oh yeah, and by the way, here's my card. That's how I get these events. I'm a walking, sort of holding, getting event. If I'm just like you, nobody won't know that this person is a diabetes ambassador. So I do that. So don't talk about hard to reach communities. Say instead, historically excluded, neglected, historically ignored, marginalized, underserved, or underrepresented. If Muhammad can't go to the mountain, excuse me, the mountain should go to Muhammad. And I go to places where people have hearing impairment, people who are autistic, people who have learning disabilities. I want to seek those places out, people who are deaf, people who are blind. And sometimes when I go to the deaf community and they have the interpreters, the signed interpreters, they ask me some of the most simple questions. And then I would say to the interpreter, well, why do they ask that? And they say it's because they are a forgotten group. The health service don't engage them at all. They just think, well, oh, they must be shunted away. They're human beings at the end of the day with blood running through their veins. And they, more than anybody else, with their hearing impairments or what other disabilities, they need to get the health and well-being message. Are you with me? Even more than us who probably know it all. So I go and seek these people out. And I think some people say to me, I compare myself, I'm not saying Jesus, but when Jesus came on earth, he never went to the temples and the churches. He went onto the beaches, into the agora, into the marketplace to find fishers of men and women. So that's why I go knocking on Gurdwaras, mosques, churches, synagogues, residential homes. I just go there and make myself known. Some people say, well, are you a doctor? I said, no. Patient expert. They said, well, if you're not a doctor, we don't want you. In other places, who once they hear me, they put me down in a diary for 3 times a year because they say, my God, the way how you say it all, that's the message needs to get out into communities. You're a patient expert, you know what you're talking about, and that's what we want. So, I don't go to health clinics, medical centers, or hospitals. The people in health centers, medical clinics, and hospitals are already there for a reason. That's the reason they're there. So why would I go to somewhere like that? I go to the hairdressers, the barber shop, where they're playing the domino, the car boot sale. Those are the places that I go to. I'm going to ask, and I have goodie bags to give out, prizes I should say. There are 10 top countries in the world, 10, where diabetes is rampant. Shout them out.
America.
There you go, America. Who said India?
India.
India?
United Kingdom.
United Kingdom? No. We stop there. Feast your eyes on the top 10 countries in the world where diabetes is rampant. What I can say is I'm glad, because I do these events so often, somebody always shouts out, Jamaica! Bangladesh in 10th place has 8.4 million people. On the island of Jamaica, 3 million people live there. So Jamaica could be in the top 10. Now, in the top 10, I'm going to point out to you, there are 5 Asian countries in the top 10. China, India, Pakistan, Indonesia, and Bangladesh. Now, some people said to me, Tony, I have never seen a fat Chinese man or fat Chinese woman. If you have that idea in your cranium here on your brain, as of today, you're going to think differently. It is not only people who are overweight, obese, morbidly obese, or fat, or whatever words we want to use to describe them, who can develop this medical condition. I'll show you a slide later. People who are slim, people who are meager, people who are thin can also develop type 2 diabetes. And remember, this is relative because it's 2 billion people live in China. And what's the staple product of China? Rice. And from where we're sitting or standing, they're eating too much rice. The portion of rice you eat on your dinner plate, if I was to do all the slides with you, must fit comfortably in the palm of your hand. I'll tell you the 3 rices you should aim to eat more than any others: brown rice, wild rice, and basmati rice, whether white or brown. If you go to the Diabetes UK website, those are the rices you should be eating: brown rice, wild rice, and basmati rice, white or brown. However, somebody mentioned Britain. Britain isn't in the top 10. But that doesn't mean we must sit back on our laurels and be complacent. This basically shows all ethnic groups can get type 2 diabetes. Worldwide, this is from the International Diabetes Federation. In 2021, 537 million people had the medical condition diabetes, okay? Look at this now. By 2030, it is expected to rise to 643 million people. And by 2045, it is going to go up. The figures are projected to get up to 783. Some people say to me, Tony, that is far away. Just cast your mind back to the millennium, 1999. Ladies and gentlemen, what year are we now? Come on. You see how time has flown by? So 2030 is not that far away. And 2045, if God spares our life, is also not that far away. So when people say to me, oh, that's far in the yonder, I say, you better wake up and smell the coffee or the roses. Now, I always put this down at this point to hammer home this point. Globally or worldwide, diabetes is responsible for 1 death every 8 seconds. Make that sink in. Every 8 seconds in the world, somebody dies from this medical condition. Usain Bolt can't run 100 meters in 8 seconds. His is 9 point something, the world record. But it goes on to say, in 2021, 6.7 million people aged between 20 and 79, 6.7 million died from diabetes-related causes. We've just had coronavirus and we just had COVID-19. Trust me, the figures for coronavirus and COVID-19 don't measure up to this. This figure keeps going up year in, year out. It is a very, very serious medical condition, and that's the message we're trying to get across to people. In the UK, where we're now focusing, 5 million people in the UK have been diagnosed with diabetes. 5 million, okay? But we reckon there's another million people walking around with this medical condition and they have not been diagnosed. They have not been to the GP or to the clinic or the hospital to get a diagnosis. And I'm saying to you, gentlefolk, I am begging you, go and get your health checks done. And grab the men in your life kicking and screaming to go and get their health checks done. Because if they're there and thinking, oh, it's all fine, and they're macho and manly and nothing's wrong with them, and then by the time they get to the doctor, the horse has bolted. In Jamaica, and I've got to Jamaica, and Barbados, and Dominica, and all these countries, and Canada, and the States, a lot of these countries, they have to pay. Every time they go and see a GP, they have to pay money. The national service here is free. We need to go, and when you're going, and then you sit in front of the doctor, and the doctor said to you, oh, you're okay. Insist that they send off your blood. Give them a message from me. Ask them if they have X-ray vision to know what's going on inside of your body. They must send off your blood to go and get it tested. Open your mouth and talk when you're going to the doctor's surgery, and don't sit down there. And as a matter of fact, even when I go to the doctors, I don't go, as much as I can chat and as much as I can do this, that, and the other, I don't go to a GP surgery on my own. I take an advocate with me who can sit down, an extra pair of eyes and ears, so when the GP is talking horse, dead, and cow fat, the other person they can say, oh yeah, or so on and so forth. So you need to take somebody with you. At all times, I would say. Somebody who's a confident, a mediator, an advocate, a friend, who can also, and I don't wear these when I'm going to see a GP, because if I wear these, they're going to say, oh, this guy works for the NHS. And at my surgery, you have about 9 different GPs, and you never see the same one twice in a year. You're always seeing a different one. But 1 million people are walking around. And what I said to people is, you see, you're driving your BMW, or your Volvo, or your Porsche, and you go and get it MOT tested without fail every year to make sure it's roadworthy. I'm saying to you, gentlefolk, your body, given to you by Jah, Jehovah, Allah, whoever you worship, is far more, it's a temple, and far more important to you than that piece of junk, that piece of, and some people say to me, Tony, you can't call me BMW junk. They say, leave it there for rot. Your body is more important. So go and get your checks done, just like how you get your car MOT yearly. Are you with me?
Yeah.
And it's in many particular, at this point I just mentioned one thing, and you need to get this message out here to me. Prostate cancer is one of the easiest cancers to cure if caught early. And black men in particular are more prone, more susceptible to getting prostate cancer than white men at a much earlier age. And all they do is they suffer in silence, stop at your water, and they don't want to go and see, and the macho man there, they don't want no digital rectal examination, and all this nonsense. They need to pack it in. So I speak to a lot of men's groups back in Birmingham and say, just get rid of it. You want to see your children, your grandchildren, and you want to see the beautiful world, and so on. So I have to get the message across to them. But back to diabetes. The figures in 1998 were 1.4. In 2018, they went up to 3.8. And you heard me just say, here we are in 2024, it's 5 billion. And there's another million, we reckon, who are walking around with this medical condition and don't even know they have it. 90% of people, and you need to understand this figure, 90% of people have type 2. Remember that. So the bulk of people with diabetes have type 2. Only 8% of people have type 1. And I'll explain the difference between type 1 and type 2 in a minute. Then there are about 2% of people with rarer types of diabetes, but remember, I'm not medically qualified, so I can't speak about them. The ones I speak about is the 90% of people who have type 2. You might not be able to see these, but I'll read them out to you. There are certain wards back in Birmingham, I can talk for Birmingham, certain wards where diabetes is rampant. By naming them, you might be able to understand, and then I'm going to ask you why. Handsworth, Newtown, Lozells, Aston, Sparking, Sparkbrook, Allen Rock. Those are just a few that I've named. Why is diabetes more rampant in those wards than in Leafy, Harborne, Selly Oak, Sutton Coldfield, Solihull? Why? Shout out the answers.
Because it's Asian people.
Asian people, yes, that's one answer.
Different ethnicity groups.
Sorry?
There's lots of different ethnicity groups.
Lots of different ethnic groups, yeah. I'm not the answer I'm wanting to hear yet.
Lifestyles.
Lifestyle, yeah.
Is there a lot of fast food places?
Ah, that's the answer I was thinking. Absolutely. If you go anywhere in Birmingham, you will see, if you go anywhere in Birmingham, Handsworth, Gazelles, Leechers, Aston, Sparkle, every second shop you pass is a fast food takeaway or what I call junk food. And people gravitate towards that on their way home instead of going home to cook. And my only advice to you about cooking is, you see on the weekend, Saturday, Sunday, prepare yourself 3 or 4 meals, people. Freeze them, put them in the fridge or freezer. So on the way home, and you smell the lovely fish and chips, and you smell the Chinese food, and you smell the kebab and so on. Pass them by, I beg you, and go home, and because you know how much sugar, how much salt, how much saturated, how much oil you put in what you prepare. That's the issue why so many people are getting diabetes. You look at the kids, age 13, 14, 15, going home from school. Chips, more chips, pizza, more pizza, kebab, this, that, and the other. So by the time they get home, what mom and dad had prepared for them for the evening meal, they're not touching it at all because they're already full. That is a recipe for disaster. They keep on doing that. Monday to Friday, right through term time, diabetes is going to come their way. And the amount of young people, when I was growing up, young people never had diabetes back in Jamaica. But the amount of young people here in the Caribbean, Africa, Asia, who have diabetes because they're eating all of this junk food. You've got to get them back to basics and put them around the stove, the cooker, and get them to learn to cook. This can't cook, won't suffice. Are you with me?
Yeah.
Right, okay, moving swiftly on. This is why diabetes is serious. This is why it is serious. Every week, it didn't say every fortnight, it didn't say every quarter, it didn't say every 6 months. Every week in Britain, diabetes leads to 500 premature deaths. These are not my statistics, ladies and gentlemen. These have been given to me by the National Health Service and Diabetes UK. Every week in Britain, there are 284 lower limb amputations because of foot sores and ulcers that people have developed because they haven't taken care of their feet. Who can tell me the hospital, which happens to be in Birmingham, I know you're not Birmingham based, but who can tell me the hospital in Birmingham where more amputations take place than any other hospital in the country? QE, no.
No, it's Heartlands.
Who said Heartlands?
Oh, Heartlands, yes.
Heartlands.
Yeah, Heartlands.
There you go. The Heartlands or East Birmingham Hospital has more lower limb amputations than any other hospital in the country. They are so good at it, the doctors, that they fly patients on the helicopter on the roof from Scotland, Ireland, and Wales. And if you know anything about Birmingham, who lives around the East Birmingham area? What ethnic group? Asians in particular. So, I'm going to tell you something about foot care in a minute, why it's so important. But every week again, 770 strokes happen from this one condition, diabetes. Every week, not every 3 weeks or every quarter. Every week there are 590 heart attacks and 2,300 cases of heart failure. Diabetes is also the leading cause of preventable or avoidable sight loss of people of working age. I'm going to leave this with you. And if you don't get anything else from this presentation today, I want you to bear this in mind. I come across a lot of people who say they can't see the small print, they can't make out what's on the television, they can't make out what's on their phone, they can't read what's in the book, they can't make out images. It is the diabetes having its wicked way at the back of the eyes, causing them to have blurred vision and to eventually go blind. So I have to, every year, I have perfect vision, I don't wear glasses, but every year, because I'm type 2 diabetes, I have to go to the optician in the high street. They put the drops in the eyes, and they take lots of pictures with the camera, and they send it off to the clinic, and then I get a result. It's called diabetic retinopathy screening or diabetes eye screening because it's the retina. And if there's anything forming at the back of the eyes, the optician will tell me that, hang on. But ever so often, all I go every year, they say, no, your vision got perfect, your eyes are fine. I come across people who go, they wear glasses, and they go, and the optician tells them, because the optician cannot diagnose your diabetes, please remember that. The optician has to send you to your GP, so you get a blood test. That is the definitive thing to see. And some people say to me, oh, Tony, I'm going to go to my GP, and my optician, and the optician say, you know, something forming, and I say, look, let me hear, and I say, and what have you done about it? Nothing. Honest to God, I feel like slap them. Because if you get told that there's something forming at the back of your eye, which can lead to blurred vision and blindness, for God's sake, go and get it checked out. If in doubt, check it out. And then on top of that, we have 4 countries in the Commonwealth where diabetes, blindness from diabetes is rampant. I'll name them. Belize, St. Lucia, Dominica, where I've been, and Jamaica, where I've been. More blind people are in those countries suffering because they've lost their sight, not realizing. So if you see anybody squinting or not making a small print or what have you, don't let them just sit there. Grab them and take them to the optician, and also grab them and take them to get their diabetes done, the check done. Someone is diagnosed every 2 minutes with diabetes in this country. Every 2 minutes in Britain, somebody gets a diagnosis that they have diabetes. That is worrying, okay? So at the moment it's 5 million. By the time I probably come back here again, it will be 6 million. It just keeps rising and rising and rising. Now, I don't know if any of you do the lottery. I don't. But this is why diabetes is expensive. Some people do the lottery and they might have won 10 million. Ladies and gentlemen, this does not say 10 million. About 10 billion pounds is spent by the NHS on this one condition. There are countries in the world which don't have that sort of money as their gross domestic product. And here we are in Britain, in the National Health Service, spending 10 billion pounds on diabetes alone. That's a hell of a lot of money, which amounts to 1 million pounds every single hour, or 1/10 of the NHS budget. Okay? Now, I'm going to catch my breath, have some water while you listen to a 2-minute
There are 2 main types of diabetes, type 1 and type 2. They're different conditions, but they're both serious. There are some other rarer types of diabetes too. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. But we all need some glucose. It's what gives us our energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It's made by our pancreas, and it's insulin that allows the glucose in our blood to enter our cells and fuel our bodies. If you don't have diabetes, your pancreas senses when glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, it's a bit different. The insulin you make either can't work effectively, or you can't produce enough of it. In both types of diabetes, because glucose can't get into your cells, it begins to build up in your blood. And too much glucose in your blood causes a lot of different problems. To begin with, it leads to diabetes symptoms, like having to wee a lot, being incredibly thirsty, and feeling very tired. You may also lose weight, get infections like thrush, or suffer from slow-healing wounds. Over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, people can live a healthy life. And there's much less risk that someone will experience these complications. If you've got diabetes, you can find lots of information and support about living with it using our website and helpline. As well as campaigning for everyone with diabetes to get the right care, Diabetes UK fund research into all types of diabetes so we can develop new treatments and one day find a cure.
One day find a cure. There's no known cure for diabetes. Please remember that.
You can find out more about type 1 and type 2 diabetes and how they're treated in our next videos.
That is 2 minutes long. If you want to see it again and show your relatives, your friends, your colleagues, your neighbors, go to the Diabetes UK website. It's there permanently. Can I just ask how many people watch television? Who does the voiceover in that? Philip Schofield.
Yeah.
Now listen to the story. Philip Schofield does not have diabetes. His mother has type 1 diabetes. His brother has type 1 diabetes. I'm going to mention 2 other people who have type 1. Theresa May, our previous Prime Minister, has type 1 diabetes. And Halle Berry, the well-known black American actress, has type 1. I'm going to make it extremely clear for you. We have an organ called the pancreas, which sits here, a 6-inch gland called the pancreas, immediately behind the navel string or belly button. We all have it. It produces the hormone insulin. Without insulin, you will die. Okay? So, 102 years ago, Sir Frederick Banting, a Canadian scientist, he noticed a meager dog outside. In Jamaica, we would say maga dog. And he, with his French student Charles Best, made up this concoction, artificial or synthetic insulin man-made, injected it into the meager dog, and the dog started to put back weight on again. That was how insulin was discovered 102 years ago. Of course, since then it's been made better. So type 1, for no known reason to this day, type 1 diabetes, the 8% of people who have it, the pancreas packs in very, very quickly. The tired, the toilet, the thirsty, the thinner, the blurred vision, everything all descends on the person who has type 1. And it's nothing to do with ethnicity or age or how big they are or gender, but only 8% have it. So what those 8% of people have to do for the rest of their life, they have to inject insulin into their stomach area here 3 times a day to keep them alive. Are you with me?
Yeah.
Some people, especially children at school who have type 1, or some children get type 1, don't like to have to come out and go see the school nurse 3 times a day. So some children wear an insulin pump strapped to their body, and it drips the insulin to keep them alive. And when I do these events at some of the places, I say, sir, can the person go and have a shower or bath? I say, yes, they can take off the insulin pump, have the shower or the bath, but they have to put it back on again. That is there for, that's type 1. Type 2, which you heard mentioned there, is the likes of being hereditary, or some people carry too much weight, or the pancreas is not making enough insulin or not doing its job properly. So that's type 2. So some people with type 2 end up on insulin. Some go on a drug called metformin, and some like me lead such a really rigid life that I managed to do it without any medication at all. There are a few people who have managed to reverse the diabetes by eating healthily and doing physical activity. But if they go back to eating unhealthily and not doing physical activity, the diabetes will return. But 90% of people have type 2. That's the one you need to remember. Type 1, if you see anybody with type 1, they have no control over it at all. They didn't cause it on themselves. It's just, they just want to luck of the jaw that they got it. It's on 8%. So age is a factor. The older you get, it can come your way. Family history and ethnicity as well. Okay? Weight, body mass index is a factor. Waist circumference, which I'm going to talk about in a minute. And these are the issues for people with diabetes. Apart from all the things I've talked about, slow healing of cuts and wounds, blurred vision, etc. Some men trying to make love to their partner, there's so much blood glucose or blood sugar in the penis that it flops. They cannot have an erection. That's why it's called erectile dysfunction. That's the proper name for it. Now, so that you don't think, how come Tony Kelly know that? It's in this. Page 58. Sexual problems are more common in women with diabetes than men. So I'm going to make this up, it's in here, so on page 58, okay? So, moving swiftly on. Heart attacks is an issue with people with diabetes, as I showed you the figures earlier. Strokes, high blood pressure, and lots of black people have high blood pressure, whether they like it or not. It's just something about our DNA why we tend to get it more than white people. And high cholesterol. I'm going to give you a tip for high cholesterol. My mother, as a nurse, said to me, high cholesterol, get the message out there to people. They are to have their oats porridge. I am not talking the refined Quaker oats or Fosca oats. You go to the big supermarkets, you buy the thick, rolled oats. Have them for breakfast. It brings down your cholesterol level. Please start having your thick, rolled oats, and that will bring your your cholesterol levels down. Who knows what is gestational diabetes? Go on.
It's when you are pregnant.
What pregnancy? When you're pregnant.
Yeah.
It's not type 1, it's not type 2, it's one of the rarer types that some women only during the gestation or the pregnancy period develop. But when they've had the baby or babies, it completely disappears, it goes. What it is saying to that gestational mother, that mother, is she is at risk in later life of getting type 2 diabetes. And the baby or babies she's had are also, when they grow up, likely to get type 2 diabetes. So they have to be extra careful, okay? Who knows what impaired glucose regulation is? Anybody? I'll take tell you because I'm conscious of time as well. Impaired glucose regulation is, doctors use it a lot when I go to events. And I say, please speak the language of the people. Keep it real. If the doctor says to you instead, you are borderline diabetes or you're pre-diabetes, the word pre means before, that's what that means. You haven't actually got diabetes yet, you're borderline or you're pre-diabetes. And if you get told that by your GP or your health clinic or whatever, I am begging you, make the lifestyle changes so that you don't end up getting the diabetes. Because once you get it, that's it. How are you going to get rid of it? Okay? Steroid-induced diabetes. This is a new one on the scene. Some people are on steroids. Tony Kelly isn't saying you must just put the steroids away now. Some people are on mild steroids, like for asthma and bronchitis, the blue and the brown, and so on. They're fine. But some people who have other illnesses and diseases are on very, very strong steroids. Some steroids, for some people, the strong ones, can impact this organ, the pancreas, and cause the person to get steroid-induced diabetes. Now, those are not the ones I have the problem with. The problem I have is the ones in the gym. I go to the gym, and I'll see the man or woman, and then my size. And then 3 weeks' time, the Incredible Hulk or Arnold Schwarzenegger. And I said, excuse me, I go to them because I'm very forthright. They said, oh, you bulk up so in 3 weeks. You know what they do? They are injecting steroids into here and into here. For God's sake, if you know anybody doing that, please tell them to stop it. Because what will happen eventually is that they'll end up, if they do it over such a long period of time, they end up getting steroid-induced diabetes. And once they get that, that's it. They're getting rid of it. So if you have any uncle or niece or nephew or your son or grandchildren, and you know, sister suddenly bulk up in 3 weeks, they're supposed to take 8-9 months to bulk up. Do things the natural way more than the quick fix. Are you with me?
Yeah.
People from African, Caribbean, and South Asian backgrounds are 2 to 4 times more likely to develop diabetes than white people. It's not me saying that, it's the figures given to me. Look at the age, from age 25. White people on the whole, age 40, 15 years later, they start developing it. Why is that? It's to do with our genetics, our genes, our DNA, our metabolism. It's also to do with some of the environmental factors like overcrowding. And this is what I'm going to stress to you. Our previous speaker mentioned about stress and anxiety and so on. Stress causes blood glucose levels to shoot up. And people have been known to get diabetes because they're in a stress environment, there's too much stress at work, sexism, racism, stress from people. So I'm saying to you, breathing exercises, Tai Chi, yoga, pray, walk, do things to keep your stress levels down. Because you might think it's not impacting this, but if you have a lot of stress day in, day out, if you have domestic violence or at work and the boss stressing you out, eventually you can end up getting your blood glucose gone so high, you get stress-related diabetes. Are you with me on that? Okay? So go for long walks, take deep breaths, say your prayers to whoever you pray to, and that sort of thing, trying to alleviate all of that stress. Keep your stress levels down. Couch potato and sedentary lifestyle is another thing that I'm going to just talk about in a short while. And the poor diet. The poor diet. We within the Asian and the African Caribbean community, our diets are poor. If I had time, I would do stuff with you on diet. I have loads of stuff on that, but I won't have time to do that. I'm going to skip that and I'm going to go to this. And I want you to listen to this one carefully. Diabetes UK says all women without exception should aim for, I accept some women have babies, some women are bigger in size, etc., etc. But all women should aim for a measurement. You notice it's not from the trouser size, from the belly button, because what is immediately behind the belly button? Come on, the pancreas. So it's not down here, so not down here where the waist size is, from the belly button. All women should aim for a measurement of 31.5 inches. I know it's difficult. I remember this world competition where the model was walking down 36, 24, 36, hourglass figure. If any woman in here with a 24-inch waist, stand up and show us, please. That's not this thing. But what I'm saying to you, let's say your waist size here is 40. Let's just pick up that randomly. All I'm asking you to do as a woman, you're not going to realistically get it down to 31.5. But try and bring it down from 40 to 38 or 36 so that you're losing some of the fat that is preventing the pancreas from doing. Are you with me? All Asian men, because they're more prone or susceptible to getting diabetes, Diabetes UK says all Asian men should aim for 35 inches. So when I go to some of these groups and the Asian man said to me, "Me watching my weight, Tony," he told me so. Me say, "You better pull that in. Your weight is supposed to be up this on 44 or 46. Pull it in." And they laugh. And I seriously to them, it has to come down from 46. Now tell me about you watch your weight out there, sir. White men. It depends. You have to do certain things. I know, I accept that, but I tell you things that you need to do. White men and black men, we are allowed. White men and black men are allowed a further 2 inches, 37 inches from the belly button. So when you go home, you see your partner, your uncle, your nephew, your son, 31 and a half for all women, but we know you're not going to get there.
Inches.
Inches. I do inches. I don't know
Does
about
that
metric.
matter ethnicity?
Sorry?
Does it not matter?
No. For women, it's everybody's 31 and a half. For Asian men, it's 35. And remember, it's not from down here, it's from here.
Yeah.
And then for white men and black men, it's 37. Moving swiftly on. This is the one I need to bring to your attention. Tofu. Thin on the outside, fat on the inside. You have some people who are skinny, meager, or as mild as a ray, and they tell you that they have the diabetes, and you say, no, the fat people have. Don't dispute if somebody is thin, skinny, tells you they have diabetes, because the fat can be deposited around, although they're skinny, around the liver and around the pancreas, and they have diabetes. So please, okay? Signs and symptoms: tired, toilet, thirsty, thinner, thrush and genital itching, I should say, blurred vision, extreme tiredness, weight loss. Can we all read this at the bottom, please?
how would you know?
Now listen, that was read very franky, and I want it read with gusto and feeling, so you know you mean it. Can we read it again, please? No tired, no toilet, no thirsty, no thinner, no blurred vision, no slow healing of cuts and wounds, and you're not going and getting your regular checkups, which I'm saying you must go to your GP and get. because that's where they can diagnose it. It kept no symptoms at all and you're going around. And suddenly, after 6-7 years, your body starts to packing on you. And by the time you go to the GP, and the GP takes the blood and says, do you realize you've had diabetes so long in your system? So that is why I'm urging you. Are you with me?
Yeah.
To go and get your health checks done. Sometimes no symptoms at all. So these are the complications. Eye disease, I mentioned the blurred vision and going blind. Heart disease, cardiovascular heart disease. Kidney disease, neuropathic. Nerve disease, that's the one whereby I have to go once a year to see my diabetic nurse. And she tells me to look away. And she says, put your foot up, and I put my foot up. And she does that. And she says, did you feel that? And I said, no, because she hasn't touched me. But what she ends up doing, she touches every part of the soles of my feet to make sure the nerve endings are okay. And she says, feet up, diabetes or no diabetes. Yours are some of the best feet I've seen in my whole nursing career. I take care of my feet. And I'm going to teach my granny to suck eggs here. When you've had your bath or your shower, dry between the toes properly. Put no lotion between your toes. No lotion at all between your toes. No, absolutely not. And also, what you can put between your toes is talcum powder. But you can put lotion at the other extremities, up here and here and so on, but not between your toes, okay?
Just after the bath or at all?
No time at all must you put lotion between your toes.
Well, if
Also-
you have a foot massage when you're pedicure.
When you have a pedicure, yeah.
Pedicure and something.
Yeah, but then that's supposed to put the oils between the toes. Only between the toes I'm talking about.
Can you give the reason why, please, Tony?
But I've just been told that it shouldn't be done because it then leaves you putting your toe in your shoes or your sandals or so on, and then it's all going to be raw, it's all moist and so on and sweaty. Your toes must be dry. You know, athlete's foot will set in, this will set in the other. You just don't do that. Then another thing you need to do, what we used to have to do in Jamaica, here I have to buy at Holland and Barrett, the rough skin at the back here. The pumice stone, you have to go to Holland Barrett and Marks and Spencer. You must, because I don't walk around barefoot. I'm begging you, please. Even in the comfort of your home, on the carpet, little Johnny, Mary, Sue might come with the thumbtack or the Lego or the pin or the needle, drop it on the floor, and if you're walking around on the carpet and that goes into your feet and you're not aware because of the nerve endings, that's when the whole issue of pus and sores and ulcers set in. And you need to be mindful. I'll give you one quick story about a guy who, I was once at Six Ways Aston Church, and a chap said to me, hey, Mr. Diabetes, because everybody when they see me, they don't remember my name, but they call me, shout out. Go and see my brother, and he's in Dudley Road Hospital. And I went to see him. True story. He was at home with his son, Wolverhampton Road South, at home. A bottle dropped, and the glass fell, and he used a dustpan and brush to pick it up. But a splinter was left. The splinter went into his big toe. And he was at home, typical of what most men would do, using Dettol and antiseptic, trying to get the toe better. Instead of the toe getting better, it got worse. And somebody would visit him and say, oh my God, your toe stinks, man. This is proper stinking toe. You need to go and see a doctor. He eventually went to the doctor. The doctor took one look at him and said, you know what? Dudley Road. Seriously, they cut off his big toe because either gangrene or septicemia set in. Sadly, and it's a true story, but sad, the gangrene or septicemia had spread to his other 4 toes. They chopped off his other 4 toes. You know, don't say yet. The gangrene or septicemia spread up to here. They chopped off my friend's leg. He used to teach me the weights in the gym. And you know what set in? Because he had to be fitted with a prosthetic limb. Depression. We spoke earlier about mental health and depression and you feeling down and so on. The dark, I don't use the word black clouds, I use the word dark clouds. Dark clouds, this said, he closed every blind, every curtain in his house. He wouldn't make anybody come see him. He was so embarrassed because this is the man who used to do weights and everything, you know. And I used to have to ring him and say, you've lost a leg. You haven't lost your life. Give whoever you worship thanks and praise. And he got out of that depression and so on. So I'm begging you, even on the sunny beaches in the Caribbean. And I tell you one thing that I do. Some of you like to wear flip-flops. I go for Birkenstock. I'm an advert for them, whereby I say, if a thumbtack or a rusty nail or screwdriver or knuckle goes into that, look at the thickness of it. It's not going to go embedded into my foot. You with me? So I wait till these are on sale. You're looking at the time, I'm going to stop. Huh? All right, okay. If I wear these, then and sometimes I see thumbtacks in the bottom. If I was wearing a slim, thin one, it would go through that and into my foot. So I would say invest in Birkenstocks. They're in most stores. They're very expensive, but I wait till they go on sale and buy 3 or 4 at a time when they're dirt cheap. I don't want to get rid of them. That's what my advice to you. Nearly 3 million people have gone to the Know Your Risk on the Diabetes UK website. Take a photo of it. They put in their age, their gender, their height, their ethnicity, all the various things it asks them to do. Even before they get to go to the GP, they put all these in and it can work out whether they are no risk, no risk, low risk, LOW risk, medium risk or high risk. These are people who don't know whether they have diabetes. And what they then do, it signposts them to one of the national diabetes prevention programs, if they're pre-diabetes or borderline, where they go with others, either online or face-to-face, and work through with somebody at a slower pace how they can reduce their whole issue of diabetes. This is worth doing, the Know Your Risk tool, to find out where are you on the spectrum. Are you low, medium or high? And if you're medium or high, you need to then be signposted and be referred to one of the courses, okay? Eat a balanced diet, be more active, stop smoking. I'm not going to do these because of time. I'm going to do one. Pernicious anemia, that one I'll do. And that one, just those two. Pernicious anemia. A few years ago, I was feeling very tired, and I went to my GP, which I wouldn't done before, but I do now regularly. And he said, I have this condition called pernicious anemia, which means I'm lacking in vitamin B12. And older people are more likely to have pernicious anemia. And anybody who is vegetarian and doesn't eat meat has to take supplements because B12 comes from animals. That's where B12 comes from, okay? So I said to him, doctor, what we're going to do? They took the blood here. Oh, this is a story, no word of a lie. Every 3 months for the rest of your life, you will have to come down to this surgery and have a B12 injection in your bottom. Mr. Doctor, you can wheel and you can turn and you can come again. That's not happening. There's too many doctors in my family, plus I go to the Pernicious Anemia Society website, and this is exactly what I did. Floridix. I highly recommend Floridix. My wife prefers Metatone tonic. I'll pass it around. B6, B2, B12, no preservatives, no laxatives, no colorings, etc. I have that of a morning, and I also have the B12 one-a-day tablet. I'll pass them around. And ever since then, my B12 has been in the right range. So every time I go to the doctor, I say, Doctor, what did Dickens was wanting to juke me in my bottom every 3 months for the rest of my life for? This is why I'm saying, when you go to the doctor, you need to open your mouth and talk. And don't just put the doctors on the pedestal and they tell you everything and you just take it. So there's another one out there. I only see it in Waitrose. It's the Sicilian blood orange juice, blood red orange juice. On the Waitrose I see it in, I don't see it in any other one. That too apparently is very good for B12 to bring up. And the other one I'll mention is fructosamine. I have the sickle cell trait, not the full-blown sickle cell, just the trait. So I don't have any issues with it, okay? If my wife had the trait, the chances are our daughter would have been born with the full-blown sickle cell anemia, which is when the crisis and the blood and the pain and so on, because it's not round like the cells or corpuscles. However, when I used to go in the earlier days to get my bloods done at the GP surgery, it's the nurses or the students who take it. And they would want to put on the bottle, and this is what I'm saying to you loud and clear, they want to put on the bottle HbA1c. which tells you what you've ate or drank for the last 2 to 3 months. They cannot put that on my bottle, it won't work. They have to put, and I have to educate some of them, especially when they're new coming out of training school, fructosamine test. More black people have the sickle cell trait, sickle cell anemia, or one called thalassemia, and cannot do the standard 3-month HbA1c. So when you go, and if you have the sickle cell trait, sickle cell anemia, you have to ask for the fructosamine test, which is only for 2 weeks. Only 2 weeks. It can tell you what you've had. Okay, I move swiftly on. Kidney stones I mentioned briefly as well. I used to love cow's milk. And the more cream on the top of the cow's milk, the better. Then 1 year, a few years ago, I ended up with the most almighty pain. Kidney stones. And I said to my wife, I burst my appendix. And she said, what side is hurting you? And I said, whichever side. Even to this day, I don't know what side my appendix is on. And she said to me, don't be silly, your appendix is on the other side. I had to go to the hospital, and the doctor said to me, what do you like to drink to form kidney stones, these crystals? Once and only once I've had it. Cow's milk with the cream on top. He said, cow's milk is for the formation of teeth and bones in babies and children. Go out there and get the message. Adults don't need to drink cow's milk. I'll tell you the milks you need to drink. Plant-based milk, all plant-based. Coconut milk, rice milk, almond milk, oat milk, and cashew milk. They're all plant-based milk. Some of them taste bad like one. But eventually you get coconut milk, I'll repeat, cashew milk, almond milk, rice milk, oat milk. Now some people say to me, Tony, what about soya milk?
Yeah.
I would tell you to stay away from soya milk because most of the soya attracts a lot of pests. They then spray pesticides onto the soya which go into the food chain. So if you're going to have soya milk, go for organic, which is farmed differently. Are you with me? As opposed to the other one. Eat a healthy balanced diet. Look at the people who get diabetes more and tell me why. Quickly. Why? Because they're sitting down all the time, and by the time they get home, they have their meal, they're sitting in front of the TV watching them, and they're not watching the TV, they go up to bed, and the routine continues. Ladies and gentlemen, and you have people in your family who you have their caring for, you need movement. I'm going to end with the movement. Social prescribing, I'll do quickly. It's not a term that a lot of people know, because I'm doing this all over the place. In every GP practice, there is a social prescriber now. So instead of giving you medication, big pharma, they are supposed to take you, whether you're diabetes or not, whatever your condition might be, cholesterol level or blood pressure or too much weight, they're supposed to sit you down and say, what do you fancy? Zumba classes, line dancing, gym, swimming, and out of the GP's budget, not out of your budget. Social prescribing. Go into your GP surgery and say, Tony Kelly say, you must see the social prescriber. They're going to be frightened to know, say, you know about social prescribing. They are now doing this far more now in the last 5-6 years instead of drugs, medication. Because drugs tend to mask the problem, the underlying problem. Are you with me?
Yes.
Right. So, control the blood glucose level. This one I leave with you, food traffic lights. That was mentioned earlier. Just like how you have the red signal at the stoplight and you have to stop red, in the middle is amber, and when you go to the supermarket, I want you to pick up more greens, amber. Red is only a treat now and again. I'm begging you. And one thing I tell you, which the marketing people have gotten wrong, and we need to challenge them on it, the same thing called Weetabix. You go and look at the Weetabix label. Green. Weetabix is packed with salt and packed with sugar and packed with everything. It should not have greens on it. So shy away if you can, please, from Weetabix. But that is over there, the food traffic light label, how to when you go to the supermarket. Coming to the end now, and then I just do some physical activity. Avoid, please, smoothies. Smoothies, whether fruit smoothies or vegetable smoothies, your mouth was made to eat the kale, the carrot, the apple, the banana, the satsuma, so on. It then rolls up into a bolus, B-O-L-U-S, is a Latin word for ball. So you chew whatever is in your mouth. The saliva is in the mouth, do whatever. It goes down here, and then it's dissipating. I'm going to finish now. It goes down here, and then gets over all over the body. If you have a smoothie, this is what happens.
It just goes straight in and straight out,
And has done nothing. Absolutely nothing for you. So beg you, no bother with the smoothies at all. One, take a picture of this, please. Those are the benefits of water. I drink a lot of water because water flushes out the kidneys and the toxins and the poison out of the system, and your urine should then be a nice light yellow color and also should not smell. Most older people become hydrated, dehydrated, because they don't drink enough water. But remember, there's water in watermelons, cantaloupes, grapes, satsumas, oranges, etc. And you know what I'm going to beg you to do? You're going to a place to go buy no fizzy water. When water drops from sky, it's fizzy. So when you can see everywhere you go, you see people with fizzy water, carbonated water. You drink sorts of plain water. Because the fizzy water, they've had to put something in it, and trust me, you will put on weight.
But it is good for oxygen and the stomach.
Sorry?
The fizzy water.
The fizzy water is no good for you. Full stop, Peter. End the argument. And that's Diabetes UK. That's on some of the cards there, their website. Thank you very much.